So they came out with a new study. It suggested in the study that attending HBCUs offer protection against some health conditions for Black Americans. Now, they said Black people who attended HBCUs, they say, appear to have a lower risk for health problems later in life. So compared to Black people who enrolled in predominantly white institutions, PWIs. So researchers from Ohio State University found that data from the National Longitudinal Survey of Adolescent to Adult Health showed that Black Americans who attended HBCUs were 35% less likely to develop metabolic syndrome by midlife than counterparts who enrolled at a PWI. It said the results were amplified among Black adults who grew up in segregated areas. It said metabolic syndrome is characterized by having 3 to 5 major risk factors for heart disease, stroke, and diabetes. It said the 5 factors include excess stomach fat. It said a high level of triglycerides in the blood, low or good cholesterol, and high blood pressure or blood sugar. Okay. So they said Cynthia Colon, she is the Ohio State University professor and lead author of the study, spoke about the health implications of higher education. He said, we've known for a very long time, he said, that the many years of completed schooling someone has, the better their health is likely to be across the course of their life. They said, but there's very little research looking at the different contexts in which education occurs and their impact on subsequent health outcomes. And she added that the study showed attending an HBCU can be health protective as well as after the person graduates. Okay, this is the thing. Basically, what she's saying is, if you go to HBCUs, be around the people in your community, you're gonna fare a lot better. Well, they have been putting out that racism is a health crisis, is a major health crisis. Racism causes stress, it causes anxiety, causes depression. A lot of Black people, fear, their life can be taken from them at any moment by one of these race soldiers, okay? Versus, when you at a HBCU, you don't even think about those things. It's no different in your neighborhoods. You don't even think about those things now unless you got Pookie and Ray Ray around. But if you don't have Pookie and Ray Ray, we don't think about those things whatsoever. We look at this thing with COVID. Look at all the COVID carriers. They don't wear masks. They sitting up here want to be in people's face, even though we got cases just going all out the roof now, and they still don't want to wear no mask. So yes, between the racism and all the pressure that comes with that, and then the COVID carriers who don't want to wear no mask, it could be an issue and problem for, Black people. And, I definitely can believe this. Definitely can believe this. Because you got to think about that. Even in the African continent, they didn't have coronavirus until people from Europe started coming and bringing it down there. So this study definitely has some validity to it. That's for sure. Basically what they're saying is, stick with your community as much as possible. Go to the HBCUs, get your education there. I'm a firm believer that's what we should be doing anyway. But leave me a comment, let me know what you think about this particular study about the health of Black people, basically going to Black colleges and you don't have the health problems that you could have later. It definitely says a lot.